Since the armed conflict erupted in South Sudan in December last year, over 800,000 people have been displaced and over 50,000 forced to seek shelter in neighboring countries. What began as a split within the ruling party quickly ripped the world's youngest country apart along ethnic fault lines. And as entire towns and villages came under attack, medical care facilities were not spared. Médecins Sans Frontières program manager William Robertson says the violence carried out against the wounded and sick and against those seeking shelter in hospitals and against medical facilities themselves have far-reaching consequences for the hundreds of thousands of people who are cut off from medical services.
We could count at least 4 hospitals where patients have been killed. We can take here the example of Malakal, where 11 patients were shot dead in their beds, or Bor Hospital, where at least 14 patients were killed and 1 Ministry of Health staff member killed as well. Or in Bentu, where at least 58 people, including a Ministry of Health staff member, were killed.
Patients too weak to flee the fighting have been shot dead. MSF has been forced to withdraw after the hospitals were attacked.
You know, they used to come, 10 or 5 or 15, they come in there with guns. You're telling people, your mobile, your money, your what, if you don't give, they just shoot you. And even they beat us, all of us, in all words, that they're in that hospital. And some of them are shot. And even they took some girls and some women. They took it, and where they are now, we don't know.
Robertson says President Salva Kiir and the opposition leader Riek Machar need to dialogue and raise awareness about the impact of the crisis on the provision of medical care and encourage positive change towards ensuring safe access to health care for the people of South Sudan. According to Robertson, Doctors Beyond Borders has lost track of many of their patients.
We ask that all those who are in political power, and also those who are actually armed men or armed combatants, to do to respect of health facilities. It's not only health facilities that are being damaged, private property, government building, institutions of learning are being occupied and destroyed. As a medical humanitarian organisation, our focus is on healthcare, and this is where we will put most of our effort. And we are most gravely concerned about the destruction of hospitals. So we need that all parties, including those persons who are carrying arms, to socialise the message that healthcare facilities need to be protected. This is one of our key messages.
Aid agencies warn of the risk of famine should fighting continue, and cholera is spreading with over 50 people dead. What has been particularly alarming in the current conflict, fighting between forces of President Salva Kiir and troops loyal to rebel Chief Riek Machar, has been marked by widespread atrocities and, according to political analysts, has pushed the world's youngest nation to the brink of famine. Kiir and Machar committed themselves last month to a third ceasefire deal and agreed to forge a transitional government within 60 days, but fighting continues. For some of the South Sudanese with nothing serious injuries to continue seeking medical attention, South Sudan President Salva Kiir has to ensure that the medical facilities are safe. And now it is upon the president and his opposition leader Riek Machar to put their differences aside for the sake of that young nation. Reporting for Ebro Africa News, I'm Brenda Zeda.